Hello and welcome to Agnes's lively A&P classroom. I'm Agnes, and as a registered nurse and an anatomy and physiology educator, it's my job to make the human body make sense. So today, we're going to dive into a condition that starts with just one tiny error in a single protein, but spirals into a life-altering disease that affects the whole body: cystic fibrosis.
So how are we going to tackle this? Well, here's our game plan. We'll start with a patient to see the human side of it. Then we're going to zoom way in, down to the molecular level to find the root cause. After that, we'll see how that one little mistake creates all the main symptoms, how it impacts the entire body, and finally, how we diagnose and treat it. Ready? Let's get into it. Before we get into all the nitty-gritty science, I think it's so important to see how a disease actually affects a person. So let's begin with a patient's story.
Okay, picture this. You're in a clinic, and a parent brings their little one in. They're worried. The child has this cough that just will not go away. They seem to catch every cold that goes around, leading to chest infection after chest infection. And maybe the most puzzling part, they eat really well, but they're just not gaining weight. These are the classic first clues that something deeper is going on.
And that brings us right to the heart of the matter, all the way down at the cellular level. See, the real problem isn't with the lungs or the pancreas themselves. It's with a tiny, broken gate on the surface of their cells. This gate is actually a protein, and it's called CFTR. Let's take a look at how our airways are supposed to stay clean. The cells lining our airways are covered in this nice, thin layer of watery fluid. This lets these tiny little hairs, called cilia, do their job, constantly sweeping mucus up and out. It's like a little escalator for gunk. The secret to this perfect system is a delicate balance of fluid, controlled by two little channels. One called ENaC, which pulls sodium into the cell, and the star of our show today, CFTR, which pushes chloride out. Cystic fibrosis transmembrane conductance regulator. Yeah, that's a mouthful, I know. Let's just stick with CFTR protein. Its job is actually pretty simple, but it is absolutely vital. It's basically a gate or a channel that only lets chloride ions pass through. And here is one of the biggest rules in all of physiology. Wherever salt goes, water follows. So by controlling chloride, the CFTR protein is really controlling where the water goes. Now, let's see what happens when that gate is broken. On the left, you've got that normal, happy balance. But on the right, in cystic fibrosis, that CFTR channel is mutated. It's stuck shut. Chloride can't get out. So what happens? Well, the chloride gets trapped inside the cell. This creates an electrical imbalance, and the other channel, ENaC, kind of freaks out and starts pulling in way more sodium to try and fix things. Now you've got all this extra salt, sodium and chloride, piling up inside the cell. And remember our rule? Water follows salt. So water gets sucked out of the airway fluid layer and into the cell, leaving behind this thick, sticky, dehydrated mucus that those poor cilia just can't move. And what's wild is that this is a genetic disease. While there are a bunch of different mutations that can cause CF, one specific error is responsible for the vast majority of cases. It's the deletion of just a single amino acid called F508del, and it's the culprit in about 70% of all cases. Think about that. One tiny genetic typo is responsible for breaking this critical cellular gate in most patients. Okay, so we've established we have this broken gate at the cellular level. But how does that tiny little problem create the big symptoms we saw in our patient at the beginning? Let's connect those dots. Before we even get back to the lungs, let's look at the sweat glands, because they give us a really simple model for what's happening. Normally, as your body makes sweat, the CFTR channels in the sweat duct pull the chloride back into the body so you don't lose too much salt. And of course, sodium follows along. But in CF, the broken CFTR channel can't reabsorb that chloride. And since positive and negative ions like to stick together, the sodium gets trapped out there in the sweat too. And the result? Unusually salty sweat. It's one of the hallmark signs of CF. It's the same broken gate, just doing the opposite job. All right, now back to the lungs. That thick, sticky mucus kicks off a really devastating chain reaction. At first, it's just a cough, the body's attempt to clear things out. Soon, it becomes a productive cough with that thick mucus. Well, that mucus is also the perfect breeding ground for bacteria, which leads to chronic infections. Over time, all those infections cause permanent damage, leading to shortness of breath, which we call dyspnea. In the late stages, you might even see things like clubbing of the fingers and eventually respiratory failure. You can see how each step leads directly to the next. And here's a really key point.
this is not just a lung problem. That one faulty protein triggers a whole cascade of complications pretty much everywhere in the body. It truly is a multi-system disease.
This really lays it all out, doesn't it? It's like a perfect storm in the lungs. You have the defective CFTR protein, which leads to poor mucus clearance. That causes airway obstruction. That obstruction then becomes a breeding ground for nasty bacteria, like Staphylococcus aureus or Pseudomonas aeruginosa. This relentless cycle of blockage and infection causes severe, permanent lung damage. Things like bronchiectasis, where the airways get all stretched out and damaged, and fibrosis, which is basically scarring.
And this issue goes way beyond the lungs. In the pancreas, for instance, that same thick gunk blocks the little ducts that release digestive enzymes. Without those enzymes, the body can't break down and absorb nutrients from food. And that's why our patient wasn't gaining weight, no matter how much they ate. This blockage also damages the pancreas itself, often leading to a specific type of diabetes. You see similar blockages causing problems in the intestines, the liver, and even the reproductive system. All of it from that same thick obstructive fluid.
Okay, so we know it's going wrong on a cellular level. So how do we actually diagnose this? And more importantly, what can we do about it? Well, everything we do is directly tied back to fixing the problems caused by that broken cellular gate. Diagnosing CF is really about connecting these dots. First up is the sweat test. It's so clever because it's a direct look at that ion transport problem. If the chloride level is over 60, that's a huge red flag. Then genetic testing can go straight to the source and identify the actual mutation on the CFTR gene. And finally, imaging like a chest X-ray or a CT scan lets us see the consequences, the physical damage that years of mucus plugging and infections have done to the lungs.
And just look at the difference in detail here. The chest X-ray on the left shows us some general signs, like hyperinflation, which means air is getting trapped and can't get out. But the high-res CT scan on the right, whoa, it gives us a much clearer, high-def picture of the damage. You can actually see these circular, widened airways. That's a classic sign of severe bronchiectasis, a direct result of all that chronic obstruction and inflammation.
So the way we treat CF makes perfect sense when you think about what's actually happening. Goal number 1, we have to help the patient clear that thick mucus using things like physical therapy and special medications. Goal 2, we have to be super aggressive about preventing and treating infections with antibiotics. Goal 3, we give them pancreatic enzyme pills to replace what their body can't release. And goal number 4, which is the most exciting part of modern medicine, we now have modulator drugs that can directly target the faulty CFTR protein, actually helping to fix the broken gate itself.
All right, let's bring this all home. We've journeyed from a single gene all the way to a complex, body-wide disease. Let's recap the whole story one more time.
This right here is the crucial takeaway. It's a domino effect. It all starts with one genetic mutation. That mutation creates a faulty CFTR protein. This broken gate leads to defective ion transport, which traps salt and water inside the cells. This creates the hallmark of the entire disease: dehydrated, thick, sticky mucus. And finally, that mucus clogs up tubes and ducts all over the body, causing a cascade of obstruction, infection, and damage. From the gene to the protein to the organ to the whole system, it's one logical, tragic chain of events.
And that brings us to our final thought. For decades, all we could do was treat the symptoms, the mucus, the infections, the digestion problems. But now, with these incredible modulator drugs that can actually help the CFTR protein work better, we are finally intervening at the root cause. We are fixing the tiny broken gate. So I'll leave you with this question to think about. As these therapies get better and more widespread, how will the fundamental story of cystic fibrosis change for the next generation? Thank you for joining me in the classroom today.